love this timer thing. It's great. I wish we should have these at all meetings. I think to help us keep on track. So I'm sorry you've got me monologuing again, but we're gradually getting towards the end of the meeting, and it's great to see so many people still here. It's a triumph of resilience. So thanks for the introduction. I think what we decided amongst ourselves that we'd like to do with this session is to take a slightly rounded kind of view. So, I mean, I come from a fairly traditional, not in Ashutosh's sense, but you know, kind of traditional classical medical education background, and I've both obviously been trained myself and was involved pretty extensively in certainly in postgraduate medical education in the UK, and to a lesser extent other professional disciplines. And so I'll certainly pick up that challenge about, you know, kind of around, do I still think that, you know, like, if you like, the way I was educated is still relevant? You know, maybe that needs to change in the light of some of the topics that we've been talking about, both in terms of changing health needs and health expectations and workforce and economics and all kinds of stuff as we move forwards. And then I think Ashutosh is probably going to talk to us about kind of resilience and well-being in the general public. Ashutosh, is that fair?
Okay.
So just talk to us about, you know, kind of building resilience and routine and how that can help us with our general health. So educating the patient in that sense. And then Trishala has got a special interest in, from her own practice in Mumbai and endocrinology, and, you know, what we can do to help make patients more informed about their kind of conditions, if that's okay. So Ashutosh, should we start with you perhaps? I mean, I know that you're building this practice in Japan now, based on, you know, pretty traditional practices from India, and you know, I think we've talked a lot during the course of this meeting on, you know, how we can encourage patients to adopt kind of healthier lifestyles, healthier practice, more mindfulness, and so on. So perhaps, do you want to tell us a little bit about what you're doing and how that can help with patients? And then you also wanted to say something about kind of developing the people who are delivering that, right? So yeah, so please, go ahead.
Yes, so our main service is routine, basically. We provide routine. And in Japan, we have seen that people are the root cause of the health issues, you can say, especially mental health. We are focusing on mental health, and I always say that we want to make zero stress, zero depression, and zero suicide Japanese society with the power of routine. So we provide daily techniques, some special techniques which I have shared yesterday for normal people. And other thing is more of traditional approach we are following, traditional approach of yoga and Ayurveda. And we are working very closely with Ministry of Ayush. So I'm very thankful to our Honorable Prime Minister of Bharat, India, Shri Narendra Modi ji, who has brought all the traditional schools or organizations of yoga, Ayurveda, Unani, Siddha, homeopathy, everyone together, and made the ministry and also gave more power to them so that they can design the courses not only for patients. We are not focusing mainly on patients, I mean Patanjali Japan Foundation, but they made the proper courses for patients and also for normal people so that they can lead a healthy lifestyle. And what we normally do is we focus on yogic practices, daily morning, daily evening, or daily anytime, one time. And I call it, in Japanese, I call it Juden Jikan. It's a recharging time. So we recharge we charge our mobile phones, right? Our electronic devices. So why don't we charge our body, our physical body, our mental body, our emotional body, social body, and spiritual body? So on daily basis, we have to charge our body these bodies, is gross body or maybe subtle body, casual body on daily basis. So this routine what we are trying to provide. Other than that, we are also working on the teacher's career plan. So right now there is no career plan of yoga and Ayurveda teachers. So we are focusing on how to build a career plan so that they can also have a sustainable source of income.
Okay, so tell us a little bit more about this routine thing, because I think the power of routine is actually pretty interesting. So, how long does it take to establish a routine? What, does it actually matter what you do, or is it the fact that you are expecting to do the same thing, and that in itself is helpful? What do you think?
Yeah, making a routine in Japan especially is super difficult. I started in 2012 and I could make it in 2019. 19, and I started counting in 2020. Yes. So it took a lot of time because of lifestyle in Japan is so I don't know, it's very difficult. We start our day from whatever time, 6 o'clock, 7 o'clock, and we just think about our work. Mentally, we think about our work. Fortunately, I don't think anything, so I was very mentally stable and strong. But normal people, they think about work and they just go for work, and they have so many meetings and they cannot leave office before their boss. And they go for this nomikai concept, a drinking party concept on daily basis almost. They go back by last train. So by maybe 12 o'clock or 1 o'clock night time, normally they go back to their home. So they do not have proper routine actually. So this is very difficult. And for food habits also, we do not have proper routine when we are eating, what we are eating, just eating something, any trash we are eating actually. Anything, we just eat anything. So making routine was super difficult for me also. But I tried. I failed many times, tried, and then finally when we started counting, so I can say 900 days daily, more than 900 days, we are practicing this daily techniques of breathing exercise. And we are the only organization in Japan who is never missed and never delayed, not even a single minute. We are always there. That is why people have more trust on us, and they are also getting benefit with the routine. So for example, right now this yoga day, today is International Day of Yoga. Congratulations, happy Yoga Day everyone. So we have done 75 days of daily yoga program in Japan. And it is difficult to have a daily day. For us, it's easy because we are doing our last 900 days. But it's difficult for everyone. And people who joined from day one to after like 75 days, the benefits, health benefits which they are getting. Last year, one yogi, yes, I don't call people patients, I call them yogi. Yogi means the yoga practitioner. So one yogi joined last year, and she was in medication of depression. She left the job and she was in some center for rehabilitation. She joined our program for last year was 31 days. And after that she became our regular yogi. And her medicines are going down. So this is, she's in bipolar disorder, right? So this routine is helping her actually. So power of routine is there. I can say, please join it for 3 months and tell me the result. 3 months. Okay,
sounds good. 3 months. I feel in my head I've got a number of 30 days from somewhere, but maybe does that sound familiar to anybody else about how long it takes to establish a routine? But you said something very interesting, which is obviously, I mean, I've never been to Japan, and I know very little about their culture, other than the fact that I thought that they ate quite well, actually. I thought they're supposed to have a healthy diet, rich in fish and seaweed and things. But so apparently that's another illusion busted for me. But so...
Sorry, Japan.
So tell me, how do you... So what strategies or tactics or what have you done to kind of break into this very busy, hectic kind of lifestyle? So how can you help people to build a routine into their day? What's worked for you and your organization?
I think pandemic worked. I can say that. Because I remember...
Blessing in disguise.
Yeah. So we started, I mean, we started many times. So again, in 2019, January, I started again. I said, okay, let's meet daily at this time. So we fixed one time, and we'll do online and no offline. So people, we do not have time in Japan. So they cannot go somewhere, and only online we'll do 30 minutes. Only 30 minutes we will start. We started with different timing, 5 o'clock morning, 6 o'clock, 5:30, 7, like that. And for 1 year, nobody came.
Right.
Nobody, no one. Only I was there on my phone, and I was talking that, okay, now from now we will do this, and I did.
Right.
I was feeling that somebody is there. And then pandemic came, and then I restarted on 20th of April again. And from that time, by that time we already standardized things, okay, that we cannot do daily, let's focus only on weekdays, not weekend. And I was also working on the career plan of yoga teachers. So how, when they join the organization, they cannot work on Saturday, Sunday also, or national holiday also. And when pandemic started, people started joining, and because they were free, they can just join. It's free of cost, they join. And they started getting benefit. Then they just addicted to better thing. Yeah.
Sure. Okay. All right. Well, I'm sure we'll come back to you, Norris. I mean, I think clearly, helping people to, be calm, manage their stress, manage their life, have routines is I do think is very important, extremely helpful. Moving on to Trish. So you explained to us about how you kind of you moved from a hospital practice, and noticed that many of your patients were coming to you with quite similar sorts of issues, and you were having very similar conversations. Do you want to take us from there about kind of how to help people educate themselves really about their conditions and their bodies?
Yeah, that's right, Andrew. I mean, I've been in this field for a very long time now. Had a personal journey myself, and I've been through this. So the biggest struggle that I faced was, as a patient, I had no idea what's going on with my body. So to get simple answers like, why do I get headaches in the morning? And I have to visit a doctor to get the answer that, oh, you are dehydrated. I think that's because we're not in touch with our body, and we have no idea, there's no mind-body connect. Maybe because I was not taught about this. The entire education that I've got in school, I've studied history, I've studied geography, and trust me, I don't think when was the last time I used what I studied in my school. Forget school, I don't think I use what I studied in my med school as well. Because as the time is passing by, everything is becoming irrelevant. So how do you survive? You survive by listening to your patients. They are your biggest teachers. We keep running behind universities, we keep running behind getting certifications just for the sake of getting a certifications, okay? So I've done that all my life, just because I wanted something in front of my name. But if you honestly ask me if I'm using any of that, no, I'm not. It's just lying inside my house somewhere, but definitely not a part of my practice. So when I started talking and I started listening, I realized that my patients are teaching me something every single day. And when I started compiling it, it actually became a course. And that course came directly out of patients who are going through it. And there is a lot more than what books teaches us. If you listen to your patients, I think you pretty much get the answer to what they're looking for. It's not about us. It's not about me. It's not about me as a doctor. It's about my patients, because they are living in that body with the disease. So the most common issue or common questions that came up to me was from young girls suffering from PCOS, endometriosis, a lot of hormonal health issues. Constantly running to the lab centers, getting their ultrasound done, no idea what the report says, but still feeling miserable. So spent a bomb on the tests, but had no idea what's going on. And I kept getting these questions, like, for example, why do I crave chocolate during my ovulation phase? Or why do I have mood swings? You don't need a doctor to answer these questions. If you teach the patients, they know what to do with it. So instead of carrying a guilt of eating a chocolate during the ovulation phase, if they know why is that happening, they might be able to handle it in a very different way. So I decided that let me compile this and make a program on hormonal health, which is for my patients. And when I rolled it out, so I rolled out the first phase, and I realized a lot of colleagues asking for this information. So to my surprise, I was really shocked when a very renowned OBGY, a gynac, came to me and said that this is easy to understand. I wish it was taught to me in my med school. And that also kind of broke my heart, because it's just sad. If the doctor doesn't know how to communicate it to the patients, there's definitely a problem with the healthcare education system that we all are living in. It's all becoming more doctor-centric. It's leaving the crust of patient, which is why we are in this industry, right? That's why we are in. So that's my take, and my healthcare programs are for my patients, and then I make it a little high level for the colleagues and my nutritionists or dietitians to understand, and make it easy for the other patients to understand. So it's like a chain. You know, I normally say that lifestyle changes are contagious. If one learns in the house, pretty much everybody is trying to know what's going on. So if you get the healthcare education, if you educate the patient, the entire house gets the benefit. Versus if you treat a patient, it's just the patient. Nobody else in the house is getting the benefit. So that's my take on healthcare education.
Trish, some really interesting kind of points in there to maybe tease out a little bit. So, you know, I like that point that you made at the end about, you know, if you treat one patient, you treat them one at a time, whereas, you know, if you can educate a patient and their family and so on, and, you know, I think that can have much wider impact. And I guess, I don't know, it's perhaps a little bit unfair because I didn't advise you that I was going to ask you this, but, you know, you alluded to some of the kind of ways in which you, A, came up with the idea, and B, the content, that a lot of the content came from the patients themselves. And I was wondering, you know, if we had people in the audience, you know, or ourselves, you know, thinking that they would like to develop materials to help patients understand their condition or whatever, you know, do you have any generalizable lessons from that? You know, any thoughts on that?
Oh, yes, absolutely. So it's all through experience, okay? I didn't have a mentor who could guide me to build any course or make it easy for people. I had to kind of get under the carpet to understand what's going on. So definitely understanding what topic is relevant, taking surveys. I did a lot of Instagram surveys, okay? So I think I'm a little up from a Gen Z generation. So I'm a lot active on Instagram, and so I decided to take that up, and I started posting surveys, questions, very basic questions. So, for example, how many of you have mood swings during your menstrual cycle? Or how many of you feel bloated during the end of your cycle? How many of you are actually tracking your cycle? So surveys on Instagram, because my entire audience is in between the 15 to 35, 40 generation. So that gave me an idea that what people are looking for. So instead of what is there in my mind, I decided that let the crowd decide what they want to learn. So that was my first step. And when I was creating the questions, I started sending questionnaires, surveys to my patients after the appointment, that whether they understood what I'm talking, and do like a mini quiz. And the mini quiz, if they're getting good marks, that means I'm doing good work. My patients are understanding what I'm talking. So that started I started creating a book on it. So it's not like a published book, but like a manual that I could use on a very rough basis. And pandemic worked greatly for me that way. I had a lot of time, so I used online platforms where I can go upload my videos of what I'm talking, using the diagrammatic representations, using animation videos, so that, I used to do like a mini quiz. So created course, step-by-step course. Then I realized that the course can be misused. A lot of people with half knowledge will just record the videos, put it on social media, and the whole idea about the course will get misinterpreted. That if I'm trying to explain a topic from the scratch, and if they're only picking up one sentence and just sharing the video somewhere, it won't be fair to the audience. So I did not want to give that message outside. So I decided to protect my videos, and I decided to get into a little bit legal, make like a legal document, password protected, and everything, so that the videos cannot be recorded. It cannot be downloaded. The access would be only till the time I am giving it to the patients. And it's all in my control. So they can watch it till the time they are in the treatment with me. They can make notes. They can ask me to share the videos, but they won't have access to do it. So this really helped. This really helped from the data to get misused, misinterpreted, and it's just working in a very systematic environment. So surveys was my first step. Instagram surveys. I used Instagram for this. I did not go anywhere. I just raised a poll on Instagram, and that just worked for me. So that was the starting point for my course. So I think anybody who's trying to learn about a course, build a course, I think any social media channel would be a great option to start with. And it just helps you understand what the population is looking for, that's all.
Okay, I think there's some really valuable advice in there, actually, and absolutely generalizable, I think. Maybe not Insta for my generation, but, I'm sure you can, find media that, your target cohort are accessing, get them to communicate amongst themselves. I think the idea of, some kind of self-assessment or quiz type things kind of interesting. Certainly, I remember being taught that, this kind of crazy statistics, like patients typically remember about 1% of what it is that you actually have a discussion about when they leave the consult, even to the extent of failing to remember diagnoses and treatments and recommendations and things like that. So I think, that this sort of reinforcement is very valuable. And I think, the business about the kind of internet security piece, I think, is pretty valuable as well. I mean, I'm slightly hesitant to corrupt your motivation, but I mean, the other piece obviously is around monetization and intellectual property and things like that, which may all be relevant too. Ashutosh, did you have any questions for Trish about this kind of approach with her clients? And
it's very good insight, actually. What I did was more of talking to people directly. Maybe I'm also from older generation. But we will also use your approach of posting questionnaire through
So
Instagram.
I definitely talk to my patients, right? So that's where I got my first-hand motivation to do this. And then it's a very small population I'm looking at, right? How many patients will I see a day? Maybe 10, 50? But beyond that, I need to know what's going on. So I got the motivation from my patients while speaking to them over video calls, meeting them in person, understanding their gestures, their emotions, their facial expressions, about the knowledge, whether they are receiving it, whether they are enjoying it, not enjoying it. And then I shifted to Instagram, you know, so, but yeah, the starting point was, of course, talking to patients in person.
Can I ask one question? Most of your audience are from within India or like from outside India also? And which part of India?
Actually not. I don't have a lot of patients from India.
Okay.
I have patients across the globe, US, Singapore, UAE. I have patients at Alaska, Finland. So that's quite exciting and very diverse. So I work across the time zones sometimes. But it's very exciting to see what's going on and how much the technology is helping us in reaching out to different patients. I do have a lot of patients in Japan as well.
Also? Great.
I do. So yeah, I mean, it's like, it's not just India, yeah.
Thank you.
All right, fascinating stuff. Okay, well, just to sort of mix things up a little bit, I'll kind of bring the conversation back around a little bit to the business of, you know, should we be rethinking the way we educate our healthcare professionals and our doctors in particular. Now, I remember being told once that the undergraduate medical curriculum is just about the most hotly contested piece of educational real estate on the planet, right? And, you know, for the last 150 years, people are saying, well, you know, you've got to do more anatomy or more biochemistry or, you know, more pathology or whatever it might be. You know, I think we all sympathize with Trisha's aspect. I remember when I was studying for my postgraduate anesthesia exams, and I was looking at all this respiratory physiology, which I could remember nothing from my undergraduate training. And to my horror, I discovered that in my undergraduate program, we'd had something like 26 respiratory physiology lectures, of which, I mean, I could probably piece together a few facts. So there's no doubt, I mean, it's highly contested. There's a huge amount of educational theory goes into, you know, how these courses are, you know, are designed and put together and assessed, and indeed there's quite a bit of variation which might surprise people. So certainly in the UK, for example, the Medical Schools Council, the medical schools have quite a lot of autonomy, although they do, I mean, to some extent, the kind of outcomes are kind of standardized, but the methods are really not. So, you know, one of the things that, you know, that might be worth thinking about is whether we feel, you know, do we have a preferred, is there such a thing as a preferred or better style for people's learning? I mean, there's been a move in the last 20 years or so to much greater emphasis on student-selected components, on problem-based learning and things like that, and less emphasis on kind of didactic teaching. And that, again, you know, the sort of educationalists are quite divided about that. But I think one of the points, I think it was Dominique made on the first day of our talk, was that notwithstanding all this stuff about, you know, kind of, you know, normal physiology and biochemistry, and then the introduction of pathology and pharmacology and so on, that there is, I think it's safe to say, there is very little emphasis on kind of, you know, what you might call well-being and staying healthy, and that there's a sort of tacit assumption that our first encounter with the patient is when they become ill. Now, which may or may not be the right way to do it, but it would obviously, as our colleague David was saying as well the other day, you know, our aim should be to keep people healthy for as long as possible, And I think that's where I think Ashutosh's approach and stuff is super helpful. The dietary advice we were talking about, we heard about kind of salt and sugar and things like that. And I think most of that is not terribly complicated science to get across to our undergraduates, but the difficult bit is the implementation. So it's how do you have those conversations? I mean, even today, just earlier on, we had a bit of a difference of opinion in a panel there between Andrew saying that he's pretty happy to kind of confront people with adverse health behaviors, versus Dominic saying generally you would favor encouraging good behaviors and making it easier to make the right choices and more difficult to make the adverse choices. So my guess is that we will see more of this being introduced into the undergraduate curriculum as we go forwards. The other part of the piece really is, again, we circle back around this COVID business, and I think as well as providing a little space in the day for people to develop new routines in Japan, it obviously affected, probably all aspects of people's lives around the thing, and including, the nature of work. I think people at work felt more isolated. They weren't necessarily working in the teams that they normally would. There was a sort of, particularly for frontline healthcare practitioners, there was a lot of anxiety about their own health and things like that. Maybe they were anxious about family members who were ill and so on. And I think it sort of, even if it didn't create it, I think it revealed a lot of kind of mental health problems in the healthcare workforce. And so one of these things is, should we be educating our health practitioners in how they stay healthy and how they build resilience? So we had, I think, David Golding earlier in the meeting a couple of days ago saying, he wished he'd been taught how to be human and not how to draw technical diagrams. And I think there's an assumption that is made that, particularly as young people, as young educated people, as young educated health professionals, that people know all about healthy behaviors and they do them. And the answer is, well, some of them do and a lot of them don't, I think. So I think educating us on how to look after ourselves, because we won't be any use to, our patients or our family if we do that. So that's useful. And then the other, we talked there about how do we communicate? And I mean, so my generation of doctors, this was just creeping in, communication skills. There was an acronym for it, which I won't, it was an extremely naughty acronym, which I won't share with you. but obviously now we understand that these things are very important. So I think building communication skills and then assessing them is quite effective, and that is something you can actually do. The whole assessment piece, I got slightly interested in a number of years ago in a rather nerdish kind of way, but it struck me quite powerfully at the time that there's a fundamental problem in assessing people's education and how effective it is. And broadly, if you want, if what you're really interested in is Trish an effective gynecologist, and are you imparting sensible information and managing your patients, that's kind of what I want to know. Unfortunately, it's a pretty difficult thing to measure. It's an awful lot easier to say, well, I don't know, do you know when follicle stimulating hormone is released in the cycle? And you can say, yes, it's released here and it comes from this part of the pituitary or whatever. So it's quite difficult to measure what matters in a way that is reliable and is fair to the people that you're asking the question, because that's quite important. I mean, however you choose to to make these assessments, and whether you're making the assessment in order to drive learning, or you're doing it in order to quality assure the program or the public, or there are multiple reasons you might do it. But however you do it, you want to be doing it in a consistent sort of way that's reliable and is telling you something valuable. And the kind of the softer you get in terms of the outcomes, the more difficult that is. So perhaps we'll put that to the audience about novel ideas around assessment, because mine are probably a bit out of date nowadays. I think there are some perhaps really kind of bigger external influences which we probably need to recognize when it comes into the healthcare practitioner kind of education piece, and that's things like the economic reality. So we heard earlier on about the difficulties we have globally with, for example, nursing shortages, shortages of doctors. So I work in Saudi Arabia at the moment, where they're doing a lot better than they were, but there's still a substantial relative shortage of doctors, especially in kind of more remote areas which perhaps are economically depressed and things. And that's a common problem. And maybe we've heard a little bit this last few days about how technology may start to democratize that. But nevertheless, the economics of providing an effective healthcare workforce is super challenging. So maybe we need to be thinking about different people doing things differently that's less resource intensive. And not only who's doing it, but how are they doing it? So can they deliver whatever that means? Can they deliver healthcare or healthcare education or resilience? Can we deliver that in an efficient way through use of social media or communication or telemedicine, whatever it might be? And that begs the question. Maybe you obviously need professional input into that, but you don't necessarily need to have kind of super expensive, scarce people resources actually delivering it. So I mean, I've done a bit of a major brain dump in the last few minutes. I don't know whether Trish or Tosh, you've got any thoughts about some of those ideas? Yeah, well, sure. Start with assessment by all means. Yeah.
Okay. What we have done is, I'll tell about what we are doing. So, according to my research in Japan, I never found any career plan of yoga teachers. And first of all, image of yoga is very much not properly conveyed. Yoga is something like doing some weird poses with some branded clothes, with energy drink, and it's some expensive sports by rich ladies who has time and money both. But as I said yesterday also, yoga is a foundation of life. But how to quantify it, that is very difficult. And in Japan especially, what they do is, it's like a self-employed thing, not a business. It's a self-employed people. They go to Rishikesh in India, they do some 200 hours of some course from some institute and have some certification and try to teach something, some pose. And they think that it is, if you do some complex pose, you are going to be more cool. It's more of like fitness thing. And they rent a place, then they collect the people, they do sales, promotion, everything by themselves, and they cannot focus on the actual content of yoga. And many people are they are injured because of their yoga practice. And there is something like hot yoga in Japan. Those teachers are also under very much depression. Yoga teachers in depression. So what I thought is, we have this career plan. Like I started my career as an engineer, so I have a career plan. Like I go to the company, I will be engineer, then I'll do something, I'll be maybe leader, manager, or maybe CEO or something. So we have this type of career plan. Why we do not have career plan for yoga teachers or Ayurveda teachers, they should only focus on the actual content, the yoga, how to teach the yoga. So in our organization, we have this principles for excellence, and we have this matrix. It's in Japanese, Shin, Gi, Tai. Tai is physical, Gi is technology, techniques, and Tai is Shin, Gi, Tai. Shin is more of spiritual thing. So it's because yoga is a discipline, it's a sadhana, discipline. In Japanese also we have do. It's like a karate do, judo, right? Sado, like that. So it's same concept of India and Japan. So based on that, we have this career plan, this matrix. So we have proper competency competency chart, and we have evaluation criteria. What you are going to do in this type of excellence, principles for excellence, to go to next grade or next rank. And in routinization also, we have this proper, we have done quantification of this routine. It's not like routine, if we make it very strict, that daily you have to do it, then it itself will give stress to everyone, right? So what we have done is, we made this belt system, like we divided 1 month in 3 parts. So less than 10 days, if you practice yoga, you will be green belt yogi. If you practice more than 10 days, you will be white belt yogi. And if you practice more than 20 days, you will be Kesari belt yogi. Kesari is the color of courage. It's a saffron color. So Kesari belt yogi. Now we can do research that if you are Kesari belt yogi for 3 months or 6 months, this type of problem are going to be solved.
Ashutosh, yeah. I think there's some really interesting stuff in there that I think is relevant for kind of, this concept of lifelong learning stuff, right? So, we all need to be, fundamentally, we all need to be motivated. Right. And, it doesn't matter how much you train people, actually, if they're not interested and motivated, then they won't do a good job. And I think this, this is one thing, having, like some kind of roadmap by which you can measure your progress is actually really helpful. And it's something that I think a lot of healthcare practitioners actually don't have. And I think that can be quite demotivating once they get out of a sort of a formal educational context. Trish, we've got a couple of minutes. Do you want to chip in, and then we'll open the floor to questions? Do you want to comment on the business of either continuous assessment of the healthcare practitioner, or even maybe how the patients can try to perhaps self-assess their own understanding? I mean, you talked about your use of kind of little quizzes for your patients, for example.
Yeah, I think CMEs is something which is very, very important, and plus that works as an excellent incentive for people to do it. So if, say, for example, the course is done in, say, 3 months, and they know about it. So if it's a layman patient doing it, obviously it's done. It's just for education. But the same course, if it's done by a nutritionist or MBBS doctor, they need to renew it. They need to renew the certification. And for that, say it could be after 2 years. And in that 2 years, I'm going to be creating an examination module where they will be tested for what they learned. And the second was to know about the new research that has happened in the same field for the past 2 years. So it's not going to be the same book exam that you give every 2 years to upgrade your CME. It is going to be more about what did you actually learned in the last 2 years after practically applying this in your current clinical practice. I think if we don't do that, the credibility is not going to be there. So that's what it is going to be about.
Well, thanks very much, Trish. I quite like that idea, actually. I mean, I'm pretty skeptical about the whole collection of CME points as a thing. And you know, the fact that you kind of rock up to some meeting and walk away with some points in your pocket. But I think your idea of actually getting people to engage with that and suggest what they've read or learned or something is quite a valuable point. Okay, well we're kind of we're running the clock down here quite quickly. Any questions from our audience?
Hi, good afternoon, everyone. Thank you for having us here and for the wonderful speaker. My name is Oradel. I'm an advanced life support instructor. Yeah, and the program coordinator of ARMT here in the Middle East and Africa. And for Dr. Trishala, right? I agree with you. You know that CME thing, the continuous medical education. Why? Would you believe, I'm gonna get this one. Would you believe me that I encountered doctors, nurses, who doesn't even know what is how to, execute high quality CPR or compression, which is as easy as 1, 2, 3. Would you believe? And they are licensed here. It's as a nurse, I made how do you call this one? An oath to protect and preserve life. But seeing your students who pass in the licensure but not able to provide a simple compression, it's like there's something needs to be done because we cannot undo, we cannot undo something that is done, and it's breaking really. And I had one experience as well that one of my students cried right in front of me. Because he did he did a CPR to his father. And when I was teaching him, he started crying because he said, I was doing the wrong thing. And his father died on his hands. So there is the gap, like you mentioned, those certificates that we gain, for just something in our name. Honestly, it's useless if we are not using it. And we don't put those in practice.
Sorry, is there a question?
No, I'm just validating her right away. Yes, thank you so much for that.
Yep. I think that's absolutely right. And that's why, I've done so many CMEs, but if you ask me, do I remember what was taught in it? Nope. Do I apply it practically? Nope. Okay? So the CMEs should be in a way that the course is not interesting, Sometimes the course is, they're not talking on to the point. So the course has to be interesting. It should be relevant to what you are actually clinically practicing. So that's what the CMEs it should be about. Thank you.
Thank you very much, panelists. Please put your hands together. Sadly, we're all out of time. We must move on.